So, I'm Luciano Agati. I'm working in the Sapienza University of Rome in Italy, and I'm working in contrast echo from a long time when I met Steve Feinstein about 20 years ago, and I learned the technique to use contrast in humans, and we did a lot of things in these 20 years. We starting from animal experiments, and then after we move in the humans, and in particular I develop a lot of works in people with acute myocardial infarction, because this is a situation in which contrast may be very useful. I try to explain you in very simple way why it's important. When you have a patient that had an infarction, some coronary artery may close completely, so the flow doesn't arrive into the myocardium, and we don't know exactly what you have to do in which time and when and how. Using contrast, you know perfectly when the vessel is closed, when you have to reopen the vessel, and in particular you may know which are the results of your intervention, therapeutic intervention. So on the practical point of view, it's a very useful technique, because you may improve your way to treat your patient with acute myocardial infarction. But there are a lot of other applications. In particular, we are in a situation in which, as you know, the coronary artery disease is dramatically increasing in our western country, but also dramatically in a poor country, as in the east country, the coronary disease is increasing. And we have a lot of different ways to look at this disease, to treat the disease. And contrast may be very useful, in particular in a poor country where they can't use so expensive techniques like CT scan or other techniques to arrive to diagnosis. Normally, in my normal practice, I have a lot of patients arrive with chest pain, and we don't know exactly if chest pain is due to heart disease or not. So, contrast echo may help using stress and some other techniques to improve our skill, our idea if the patient is really a patient that need treatment, need therapy, need drugs for all the life. So there are so different ways to use contrast in the clinical practice.